I'm now here to welcome our next speakers. Next up, we have Scarlett McNally, who is a consultant orthopedic surgeon in Eastbourne and was also the director of medical education there from 2008 to 2011. She was elected a council member of the Royal College of Surgeons of England from 2011 to 2021. And she was the 9th woman to be elected, so that's very impressive to us. She will be joined by Miss Elizabeth Belcher, a consultant thoracic surgeon at Oxford University Hospital NHS Foundation Trust. She is a member of the Cardiothoracic SAC and panel lead for the Intercollegiate Specialty Board in Cardiothoracic Surgery Writing Group Committee. Scarlett and Elizabeth are inspiring surgeons who will provide us with personal insights into the challenges of balancing work, relationships, and self-care. So we really want to welcome them, and I think Elizabeth is going to go first. I see you're there already. So welcome, and thank you so much for joining us.
Thank you. Thank you for inviting us. It's a pleasure to be here.
Thank you so much for joining us, and please feel free to start whenever you're ready.
Okay. Great.
Take it away.
Hopefully you can see my screen.
We really can.
Great. Well, thank you again for asking me to speak at your Women in Surgery conference. It's an absolute pleasure to join you today. And in this session, we're going to speak about work-life balance. And I have entitled my talk, A Theatre of One's Own. And over the next few minutes, I am going to talk about what is work-life balance, what are the benefits of getting it right, why are we at risk of getting it wrong, what are the consequences of getting it wrong, what are the components of a good work-life balance, and where are the pitfalls for us as women in surgery. Then I'll give you a glimpse of my working week, and you can see whether I have a work-life balance and whether I've got it right. And then I will just go into how I have tried to, in Oxford, create a female-friendly cardiothoracic surgical training for our trainees. So, what is work-life balance? Well, work-life balance is the relative time and focus that we give to the different aspects of our lives. And so here we've got female surgeons at work, but caring for their families, taking part in hobbies, hopefully, and enjoying time with family and friends. And that is the balance that we need to try and get right. What are the benefits of getting it right? Well, a good work-life balance is associated with high levels of job satisfaction. And when you have job satisfaction, you will be more productive. That will benefit you, but it also benefit anyone who employs you. A good work-life balance will allow you time to think and act on personal development. And a good work-life balance will benefit you in terms of your relationships, with friends, with family, and it has health benefits. Because if we get it wrong, a poor work-life balance is related to stress-related disorders. Chronic stress gives you hypertension, it gives you it gives you bad digestion, digestive disorders, and it's linked to musculoskeletal issues as well. But in particular, it affects our mental health, and it's linked to anxiety, depression, and insomnia. And chronic stress over time in the workplace leads to burnout, with fatigue and mood swings and irritability, and finally reduced performance. So we definitely need to avoid a poor work-life balance. Why might we be at risk of a poor work-life balance? Well, speaking to you from the UK, and I know there are people from around the world here joining today, but the UK features in the top 10 countries for the worst work-life balance. So we already live in a society where we're at risk of getting it wrong, let alone becoming female surgeons. The countries with the best work-life balance tend to be in mainland Europe. So we're at risk by where we live, but what about by what we do? So this study here in the BMJ was one of the first studies to look at occupational distress and stress in the workplace and linking it to illness in doctors. And this was 417 doctors, and they had a 12% severe insomnia rate. A third of them described bad feelings around eating, and there were high levels of binge drinking, with 5% of this group meeting the criteria for alcohol dependency. So we may live in a country where work-life balance might be difficult, and then we take on an occupation that might make us at risk of getting it wrong as well. But what about being a female surgeon? So this study from 2016 looked at female surgical trainee attrition and retention rates, and you can see here that the female trainee attrition rate, it was between 0 and over 7%, and the average of almost 2.5%. And I'm sorry to say that in my specialty, cardiothoracic surgery, we had the highest attrition rate during that period of over 7%. And why is that? So this piece of work by the Association of Surgeons of Great Britain and Ireland Women in Surgery Working Group showed that a work-life balance features very high in the things we can try and do and get right to try and retain and enhance the working lives of women in surgery. So I've been representing work-life balance as a balanced set of scales. And that's not what we mean when we talk about work-life balance, because it's not a 50-50 balanced work and life. There are other components. Don't forget, we need to sleep. So it's about work, it's about sleep, and it's about social life. And when one of those goes up, one of the other two has to go down. We cannot create more hours in the day. We're at risk of just choosing two if we don't get it right. Now, the title of my talk was with apologies to Virginia Woolf. Virginia Woolf, I don't know if you've read A Room of One's Own, but it's an extended essay based on lectures she gave at the University of Cambridge, arguing for a space for women in the male-dominated era field of writing. Now, the title of that, A Room of One's Own, is actually a contraction of the what she was saying in the text, which is actually a woman needs money and a room of one's own to write fiction. And so with further apologies to Virginia, I have said that a woman must have money and a theatre of one's own if she is to operate. Now, please don't mistake what I'm saying here. I'm not saying that you have to come from a moneyed background to be a female surgeon. I'm not saying that, because I certainly did not do that. But what I'm saying is you might need money to buy yourself time. So if we work a 40-hour week, we're going to spend about 24% of our time in work. 56-hour week is going to be 33%. And that is then, if we sleep 6 hours a night, Monday to Friday, and 8 at weekends, we've got 27% of our time sleeping, okay? If we need 8 hours a night all the time, we're going to spend 1/3 of our time sleeping. And what we need to be careful of here is that we don't borrow from the wrong group. Now, for us, the issue is work. Now, when I say work, I was talking about paid work, the time you will spend at work in the hospital. But do not underestimate the burden of unpaid work for women in the world. The United Nations estimate that unpaid work in some countries contributes the equivalent up to 60% of the GDP. And it's an enormous burden, mainly on women. 75% of the unpaid work in the world is done by women. And you need to be very careful as a female surgeon of this unpaid work, because it will eat into your sleep, it will eat into your social life, and it can, as you progress, eat into your career, because as you develop as a surgeon, you should be taking on local, regional and national roles. And if you're not finding ways of coping with your unpaid work, caring for children, for relatives, housework, all of that, then you will say, no, I won't go for that. I won't, that's not for me, that role. Please be careful of your unpaid work. So my working week, Mondays I operate, I have an all-day operating list, so I get to work early. I don't usually do the school run on that day, usually doing lung cancer operations, but also this is a patient who had an empyema, pus around the lung, which we couldn't drain with simple drainage, so that needs draining. And then you get cortication around the lung, and there I am peeling off that cortex around the lung so that lung can re-expand, that man can get on with his life. After that, I'll be doing ward rounds, seeing the referrals that came in, because I'm usually on call on Mondays, and I go home quite late on Mondays quite often, and eat late when I get home. If one of my colleagues is away, I might do that on a Tuesday as well, but generally I don't operate on Tuesdays. I'll do the school run, and then I'll go and do a ward round, see any referrals that came in overnight when I was on call, and then if there's time, I usually do some meetings, admin, SPA, and when we're not in lockdown, I'll be going to collect my son from his after-school club. Wednesdays, I have the COPD, emphysema MDT, and then the lung cancer MDT, and an operating list in the afternoon. Here, there's a patient who has got fluid around the heart. They've got tamponade, the fluid's pressing on the heart, and that's a pretty dangerous condition. So there I am going to burn a hole with the diathermy, and you'll see it all come out under pressure. Blood pressure goes up, heart rate comes down, and then I am fashioning a window there so that the patient, it'll drain over time. So I spend my time doing things like that. Then I perhaps get home a bit earlier on a Wednesday, and then I join the village high intensity training run at 7 in the evening. Thursdays, I have clinics, and I try and do my educational work in the afternoons. Friday, I am not job planned to work in the hospital. Sometimes I do go in if I think it will benefit me or the patients. But on Friday, I use that for my SAC commitments, my joint committee intercollegiate examination commitments as lead for the written exam, because the Future of Surgery report highlights that as surgeons of the future, we need to be involved in education and training and research. I don't have formal academic PAs, but I have published some papers this year, and I might use Fridays to do that, or I might use the Friday for my children and spend time with them if they're not at school and they're on school holidays. I'm a member of a local book club. As I alluded to, I'm a member of the running club. Our village is running a marathon this morning. I've already run my 3.5K to contribute to that this morning. So I don't think I can balance my life on a daily basis, but I hopefully try and balance it over the week. We talked about in the previous session about everyone having their own path. I'm just going to briefly tell you how I fitted my children in. I am part of a different generation to you, and we all have our own paths, but mine was that I undertook a PhD in 2000. I also was given a deferred cardiothoracic training number for deferred entry after I'd completed my research. The following year, my first child was born. I had, because I changed employers and left the NHS and gone to work for Imperial College, and I didn't qualify. I missed out by 3 weeks for my expected date for extended maternity leave. So I had 4 months off and then went back. I wasn't working clinically. I wasn't doing on call. I was doing my research. 18 months later, I had my second child. Here he is, wishing me good luck for my final exams that I took in Manchester in 2010. He sends me little notes like, keep calm and carry on surgeoning. I have explained to him that surgeon is not a verb, but in his world it is. And then I took up my national training number 3 years later than I planned. And that's because when I had my second child, my first child became very ill and developed a chronic condition. And although I'd planned to have 6 months off, I actually had 2 years off with my children. and applied for abeyance both for my research and for my national training number, and I only took it up again after I finished my PhD in 2005, took up my training number in 2006. Then I had a third child in 2009. This time I had 9 months maternity leave. Here he is wishing me good luck for my exam. And then I took up a consultant appointment in Oxford in 2011. So you can decide whether I've achieved the right work-life balance and whether it would suit you. How have I tried to achieve it, and how do I think it can work? Well, one of the ways to get a good work-life balance is to be very good at what you do. Because if your patients are doing well, that's great for them, it's great for your trust, but it's actually great for your work-life balance. I'm very proud of our excellent results in Oxford for our lung cancer work, mainly for the patients, but there's no doubt that if the patients aren't having complications all day, every day, then it's going to help your work-life balance. So my advice is be good at what you do, and I know you all will. Help other people around you in terms of their time by establishing protocols so that you can delegate, so everyone knows what's going on. People aren't ringing you all the time. They know they can ring you when they need to, but they don't need to keep asking you about what to do with every individual patient because you've got protocols. Your friends and your family will not wait. Your children will grow, whether you're at home or whether you're at work, and they will grow up without you if you're not there. So make time for them. And your friends will accept sometimes you've got an emergency, but over time, if you don't make time for them, you'll drift apart. And try and resist finding time by lack of sleep. So I reflected on my training, and I tried to develop a program in Oxford. I called it the Time to Educate program for our NTNs. So our cardiothoracic NTNs have full non-resident on call. I wrote a big business case to appoint first in trust physician associates and develop nurse-led clinics so that my trainees don't spend much time on the wards other than direct patient care where necessary. They spend time in areas of high quality training in theatre, in the MDT, and seeing new patients with me. All of my cardiothoracic NTNs in Oxford are female. They have a high volume of cases in their logbooks. They are in general experience beyond their years because they spend the time in the high quality training areas. So pick your training area if you can and ask them, how do you help us manage training, becoming excellent with a work-life balance? Between them, they have 5 children and a dog. So I think they have some degree of work-life balance. Just remember, not everyone will support you. Not everyone will think this is a good idea. So to the participant who said, am I insane to go back into breast surgery? If you ask enough people, somebody will say, yes, you are. I'm sure you all recognise here Emmeline Pankhurst, but you may not recognise Mary Augusta Ward. And Mary Augusta Ward established the UK National Anti-Suffrage League, campaigning against votes for women. I'm pleased to say that the outcome of the Women's Anti-Suffrage League is that it was taken over by the Men's Anti-Suffrage League. But just remember, you have to feel happy with what you're doing, and that your friends and family in general support you, but not everyone will think you're doing the right thing. I know we are sitting here saying some of our negative experiences, but we have come a long way, and I am very proud to be a female cardiothoracic surgeon, and I enjoy my job. There are things on the to-do list, but actually we've come a long way, and it is the privilege of my life to have been born in a country that values the health and education of all its people, including its women, and health and education are critically linked. So thank you for listening with my thoughts on a work-life balance in surgery. Thank you.
Thank you so much. It was really inspiring, and I think it's a really great idea to do intensive training. Often we are told that as women we can't be moms, and I mean everyone can choose whatever they want for their family, but I think in my first year of medicine I was told I wanted to be a surgeon, and someone asked me if I didn't want to be a mom. So it's really great to hear from somebody that has managed to nail both things. Thank you once again. We will now hear from Miss Scarlett McNally. I think she is there, but she won't be screen sharing. So a warm welcome to her as well. But Miss Belcher will stay here until the Q&A.
Brilliant. Thank you so much, and thanks for organising this. I'm having a lovely time. I've been taking loads of notes from everyone. My name's Scarlett McNally. That's Scarlett if we're friends, but whenever I'm doing teaching, I always say, but it's Mrs. McNally in front of the patient, so they know that I'm important. So just saying, that's it. So I'm talking about work-life balance now. This is a bit of a step away from what I normally do, because I normally talk with hundreds of slides, literally hundreds of slides, because as surgeons, we like pictures, and we like numbers, and we like stories, and we like ideas. But I'm talking this afternoon in a kind of formal way from the Royal College of Surgeons angle about women in surgery and so forth. So this is going to be a very personal whiz through about what it's like for me with work-life balance. So I'm going to start with karate, because I love karate, and I've just rearranged all my medals, so I'm not quite sure if you can see them there, but I've got medals and trophies there over 3 decades. And karate is amazing because you have a busy day at work and you can go home and hit people, and that's what you're supposed to do, and it's just lovely. It just is amazing. And also, as a medical student, I did karate. And if you were away and you couldn't get there, you didn't kind of let the team down. It wasn't like rowing that they needed a certain number in the boat and things like that. So that's what I recommend. And interestingly, I made all my children do it. Some of them wanted to do it more than others, but you know, while they're young, they're a bit malleable. That's a picture of, you see, I really am struggling doing this, not with slides. That's my oldest daughter with a medal on one occasion. They've all done it and done well. Because it's nice to have something you do with your children. You know, you think you make time, but actually it's quite boring just having time. So you need to kind of do stuff as well. So that's the karate. I stopped doing it a couple of years ago because I got a chronic hip injury that was it just got a bit too annoying and it was aggravating it. So anyway, so that's that. And the next thing is cycling. And I've always, not quite always, I used to drive the kids to school. I'm going to show you a picture of my kids as well. There we go. That's a very, very old picture. So I've got 4 kids. 4's too many, by the way. I'm going to talk about the kids later, but in case I forget to say this, we've got 1 left at home now who's doing A-levels, and that's lovely. But actually 4 is too many, and I didn't realise it at the time because they're all quite different and it requires quite a lot of input. And in fact, 1 would have been fine. I'm you know, particularly the way the planet's going and that kind of thing. So just to kind of change things a little bit. Back to cycling. I used to drive them all to school when I had my days off, and I'm interested in Elizabeth's talk that as consultants you have a very fixed timetable, which is lovely. So I used to take the kids to school on a Tuesday and then go to the gym and then do my pre-assessment clinic ward round, and then a clinic in the afternoon, and then go home. And I had 2 days a week where I was supposed to only work in the morning, but I did a lot of admin until school pick up at 3 or 3:20. And so, but anyway, after a while we worked out we could cycle, and it was actually much easier to then cycle down the hill. You drop off the kids, you cycle down the hill, and you're there ready for the 9 o'clock clinic. Because often clinics, you don't have to be in first thing in the morning if you've got a clinic. And if you're a consultant, you say your clinic will start at 9:10, and it does. So actually work-life balance is much, much easier as a consultant than it is, and I'm sorry for the medical students looking forward to their years of training them being a consultant, but things have changed since my time. So yeah, cycling is amazing because you need to fit your exercise in. And in fact, I'm just going to do a little plug for something. I was lead author from the Academy of Medical Royal College about exercise, the miracle cure, and the role of the doctor in promoting it. But this is 70% of ill health has a major preventable component, and this was from the Health Inequalities group that I was on because I was on the Council of the Royal College of Surgeons and I volunteered to go on it. And it's basically what can we actually do to change health inequalities, and what we can do is sort out nutrition, smoking, exercise, and pollution. And I know this sounds like I'm way off surgery, but it's very nice to have a kind of surgical approach to things. So back to cycling, people who do it's 150 minutes a week, so it's about 21 minutes a day of exercise. reduced their risk of dementia 30%, heart disease 40%. There's all sorts of numbers. We put them all in here. I've collated them. There's far better things written now, but this was 2015, which is a little while ago. So actually cycling to work and cycling home sorted that out for me. It sort of got my fitness in, and it was something that, you know, it's great for pollution and congestion, and it also saves loads of money. I've still got the same car I got when we suddenly had too many children for an ordinary car 17 years ago. And, you know, because I don't use it that often is what I'm saying. And as Elizabeth said, a lot of it is about money and about how you spend your time and how you spend your money. Another thing I just wanted to mention before, I was always full-time until 2015. So I've been a consultant now since 2001, and I was full-time all through my training. It was a long time ago, and at the time, that's how it kind of felt like it had to be, but it isn't anymore. Now anyone can request to work less than full-time, and anyone can request to do training less than full-time. And if I had my time again, I might do things differently, but you only get one shot at life. So I actually went part-time. I went down to 9 sessions a week. That's 90% of the time in 2015 when my mother got dementia. And it was just too much to manage, decluttering a big house, sorting out solicitors and banks and different accounts and all this, and bailiffs and care, and it just wasn't possible to squeeze that in. And so I dropped down a session, and that when I'd been on 11, there's various other things happened at the same time in terms of we were doing a week on call at a time in a different unit and all kinds of things. So anyway, I dropped down because I needed that time during daylight hours to respond to people's emails with a phone call or whatever it was. And we don't really factor in admin time for life, and life takes up time. So my mother's doing very well, by the way. I went to visit her yesterday and to help with care and various things. And she's still living in the same house. We've got a housekeeper, which is, I'm going to say a lot cheaper than a carer, but it works very well, and we have, you know, boxing and coxing. She's happy, and that's lovely. So going back to me, I brought myself up. My mother was running a business, and it was that era where kind of you could do it all if you wanted to do it all. So I was born in 1965. I brought myself up. It feels like I brought myself up. I could clip my own fish fingers from the age of 6. I was brought up in London, so you get the tube or the bus to school. And I kind of worked out, having seen my mother kind of running a business and having all her tax returns, the receipts laid out over the floor. And there was a recession going on. And I worked out I never wanted to be self-employed. This sounds dreadful, but I wanted to be doing something where I'd just do my job and I wouldn't have to worry about when the next time we were getting paid was, or whether I was going to get caught out for having the wrong receipts or something. And I knew if I worked hard, I could get my exams, and I did. And that then I could choose, I could have some choice. And that was brilliant for me because that's what I wanted. But the reason I'm kind of telling you this is that we're all different, but actually medical students are different from normal people, and we kind of assume that the people we mix with are like what everybody else is, but we're not. I know how hard it is to get into medical school, and I'm hugely respectful for those of you who are medical students at the moment. My other daughter, this one, she's just started at medical school, so I'm very excited. But I know you have to do amazing stuff, and you have to be driven and all that stuff. And actually, most of the population aren't like that. And what it's not only is most of the population like that, but I thought having children wouldn't be too difficult because you just squeeze them around everything else. And what I didn't realise is that actually bringing up children is a full-time job. We are just in the lucky position of being able to pay or have some other arrangements to help bring up the children. So I'm just going to run through a little bit. As I say, I kind of brought myself up. You know, I was doing what I wanted to do. So when I went to medical school, I kind of suddenly was surrounded by all these people that wanted to help people and be nice. And, you know, and I kind of, you know, I kind of did want to help people. I wasn't a selfish kind of person as I'm coming over, but it was a sort of distant thing. It was like, well, actually, no, people need to help themselves. I was really good on the psychology bits and the sociology bits, and I knew what caused ill health. But then we went into dissection at the 2-week stage, and I just loved it. I just love the idea that you physically have something in your hand and you can move it around and you can make it better and you can make the person better, and then they can go out and live their life. And I knew that I'd never be able to do the kind of job as a doctor where you give people tablets that you know they're not going to take, or from the pharmacology, the pharmacokinetics, you know that, you know, it's not going to work so well for them, or they might have some side effects and all that stuff, when actually if people could just go out for a walk, they'd feel so much better, or all that kind of stuff. I knew I had to be a surgeon. That was it. And I kind of felt like I didn't have any choice. It was just what I wanted to do. So I went, I just ploughed on. Now, in that time, which I qualified in 1989, so all of the 90s was my training. And at that time, you just basically got on with it. The karate was very useful. And at one stage, I bumped into somebody at a conference, and actually being a rare woman was quite useful. People would recognize me and I didn't know them, you know. I bumped into someone at a conference, a very senior orthopedic surgeon, and he said, "Oh, Scarlett, yes, I remember you from, you applied for our registrar job." He said, "I wanted to give you an interview because you got a black belt in karate. But the other said I couldn't because you hadn't, you know, got enough publication," or whatever it was, you know, the criteria, which is fine. I wasn't quite ready at that time, and registrar jobs were very hard to get. But it was nice that that kind of was noted. Anyway, when I got my registrar job, there were 100 people had applied for that, and there were 3 jobs, and I was the only woman applying. And once I'd got the registrar job, it was kind of easier back then, because if the nurses and the patients didn't respect you at the weekend, that was their problem. You were the only surgeon they were getting at the weekend. This was when it was very rare for there to be consultant present at the weekend. And you would operate if an operation needed doing, and you would look after the patients, and you would present them on the ward round, on the trauma meeting, and explain what you've done. And that's how it worked. And you were given your reference based on whether, you know, you looked cool in the ward round or the trauma meeting. And it suddenly became easier as a registrar, because it was, you had a long rotation. As an SHO, I was applying for a new job every 6 months and basically having to justify myself to a new set of people. And basically I was able to kind of ease my way in, because I looked like an honorary bloke. You know, I went to Cambridge. I'm quite posh. I could do posh, or I can do non-posh, depending on how it is, which is quite a useful skill, and I think, you know, something women have sometimes more than others. But basically it was the time you stayed up all night operating, there was operating to do, and you'd start work on a Friday morning and finish on a Monday evening. That was your on-call weekend. I carried on like that, and I got married. My husband's a nurse, and that's lovely. But just, you know, to put this in context, what I'm about to say, I didn't go to a dentist for 7 years. There just wasn't time to do that kind of stuff. I did my research in my free afternoon, and basically there wasn't time for anything. I would drop the car off, because at the time I was driving all the time, drop the car off to be MOT'd, and drop the key in, and then I'd have, I'd jog to work and then have to collect it after hours with a spare key. And, you know, it was all that kind of stuff that you sort of had to do. And things have changed. So I'm just saying, we're the generation that went through it in a different way. So please don't, we've kind of proved women can do it, but now we need to prove that normal people can do it, because I was surviving on far too little sleep at the time. I had 2 miscarriages. And the first one, I hadn't told anybody, and I ended up taking 2 days off in the end because of the timing and so forth. And the senior registrar on the firm kind of sneered at me when I went back and said he'd never taken 2 days off for the flu. I kind of didn't even tell him then, and I felt like I had to be like an honorary bloke. And I'm saying this because actually 20% of pregnancies end in a miscarriage. You wee on a stick and you kind of count it out, and 40 weeks later you're going to have an amazing baby. But actually that's not how it works, and it is incredibly devastating. But it's not your fault. It's kind of it just isn't fair. But as I say, it's 20% of that's across the world. Figures from but when I had a threatened miscarriage, kind of 3 years later, with another pregnancy, I told my consultant, because it was all work, and he was amazing about it. And I wouldn't have, it occurred to me to have talked to him about it, but he was amazing, and that was fine. And my son is great. And I'm just going to show you another picture of my son on his leaving school day. That's my son and my husband. Yeah, so things have changed. You're allowed to talk about life. You're allowed to demand your sleep. Please don't think because we did it, it's possible to do and it's easy to do in the way that it was. Because things have changed. And the big things that changed was the National Confidential Inquiry into Perioperative Outcome and Death, which published a report in 1999 showing that patients did worse if they were operated on out of hours. And that meant suddenly CPOD, CEPOD lists were produced. So you end up doing operations that need doing for emergency cases during the day. They saved space for people doing emergency cases during the day and for trauma cases during the day. And suddenly things changed, because then you're working with the team that you know well. And before that, you kind of had to be a bit shouty to get your case in, and you had to be single-minded and heroic and manage without sleep and, not see your family and stuff. But things changed this century, beginning of this century. But there's a lot of people who are kind of my age, you've worked out I'm 55, who are, I don't know, a dean of a medical school or something, who last did their surgery when it was in the olden days. And they think it's still like that, and it's so not. You can do 2.5 days a week of surgery, and that can count as a full-time job if you've got another couple of commitments and some on-call, and still have time with everything else. So things have changed massively. The European Working Time Directive newly applied to doctors in training from 2009. So basically every specialty is 48 hours a week maximum. And that's the law, and obviously you have to do your studying and all that stuff as well, but and everyone's allowed to request less than full-time training. And actually there are more consultants working part-time than there are people in training working part-time. So it's, we need to kind of, I'm really excited by the work that Elizabeth talked about trying to get every moment to count during training, because surgical training is quite a long time, and we need to, that's often the time when people are trying to raise a family. And this needs to work for men and for women, because there's too many people, just the generation slightly older than me, there's too many divorces there, because people work hard and kind of grow apart from their spouse. And you almost need to factor time in to stop and listen and think and talk and plan together, because you kind of only get one life. So a couple of things I just wanted to squeeze in. We always think, as I said, the pregnancy, there's a fixed amount of time you're allowed to take off, and there are rules, and you just go to the rules and you do the rules for maternity leave. Pregnancy, it's easier than being a waitress. Some people have an easier time, some people have a worse time, have food everywhere. You can get through it. It just different people do it in different ways. With teenagers, they're really, really hard work, and you need to put the effort in when they're small first, and you need to bring in your posse, the aunts that people can go and stay with for a weekend, or the grannies. Be nice to your in-laws, all that kind of thing. You need the support, because then often there's one person they want to go talk to, and it's a hard work. And I always tried to take inset days off, in-service training days for the kids when they're at primary school, to have a nice fun day. We go do something fun when there, you could go to an amusement park or something, and there were no other kids around, and no queues and things. So you've kind of got to make time and create fun things when they're little, so you've got something to bank on when they're a bit older, and some of them run into trouble. And there's loads of emails from school, and it does take a lot of time. The one thing I've made a note to myself to mention, SAS surgeons. So this is specialty doctors and associate specialists in surgery actually have, some of them have chosen to do that because it gives work-life balance. So then they are trained, but they don't choose to go through the whole training pathway and become a consultant. The problem is in other specialties, it works far better than in surgery, I think, because of the number of years and experience and stuff you have to do in order to have to be able to operate autonomously and be respected and not be moved by the department from your operating list, and you know, when another consultant's appointed and so forth. But an SES surgeon is something to consider. And the final, just to mention, I've been quite ill, and that was quite interesting. Seeing my trust was amazing. You know, obviously I had some sick leave, and then I went back to work, and I was able to ramp up what I did and change what I did a little bit, so that I was doing half-day operating rather than a full-day operating, because I got quite tired. And my trust was amazing about that. And you just think, if only you were that amazing about some of the people coming through training, that would be great. But we do need to make it better. And I will talk, as I say, on behalf of the College of Surgeons later on. So that's probably enough of me wittering on, and we're ready for any questions, I think, Elizabeth and I. Thank you.
Thank you so much. That was very insightful to hear about how to make time for your families and, you know, entertain your kids, not only like have some time with them doing nothing, as well as hearing that not everything goes straight to plan, and there's life that happens, and sometimes you need to take time off. In both cases, it's refreshing to hear about real lives and not those perfect lives that are always, you know, pictured to us, because that makes you human, and us as humans, we feel like we can achieve everything that you guys have done as well. So it's been very great. Thank you so much. Yes, we do have some questions. The first one, which I think is very nice. How do you cope with other people's expectations about you? Friends and family's expectations in particular. So any one of you can answer, whoever feels up for it.
I think we're probably at, Scarlett and I are probably at the stage where our friends and family are very used to what we do now. So I'm not sure that my friends or family are pretty surprised by it. You do come across people who make comments about what you may choose or not choose to do. I had someone ask me from our society if I would apply to be our national surgical tutor. And I was saying to him that I wasn't that keen to apply. And what I was going to say was, I'm not that keen to apply. And I was going to say, because I want to apply to be chair of our written exam and the SAC. And I didn't think I didn't want to do all three of those things at the same time. But before I could say, I don't want this role because I want to take another role, he said, oh, well, yes, you do have 3 children. And I said, what's that got to do with it? That's not what I was going to say. And if I was a man, you wouldn't say, oh, well, you have 3 children. So I did, and I get on very well with that surgeon. I know him very well. I like him. But I did push back on that because that was not an appropriate thing to say to me.
Yeah, I'd echo that. I forgot to mention in my talk, my husband's a nurse, and therefore he was the one who dropped his hours to look after the kids. You know, we had childminders and nurseries and stuff, but he was dropping off and collecting. And I think for me, it was easier at that time because, you know, it looks like, you know, I'm just role reversal, if you see what I mean. Although I still get all the emails and the, you know, some of them, life's, you know, just unbalanced, whatever. But yeah, so family and friends, no, I've only got the ones that have stuck it out, really.
It happens, but it's fine. I mean, you have a family that seems to be running and have found like the way, you know, to be balanced, and, you know, that's all like that really matters. I think this question is important for me particularly because I might have gotten very caught up with surgical society stuff, and this year particularly. So how do you manage your work-life balance as a medical student? How did you do it when you were in medical school? You've mentioned you do karate and you go on runs with the village, both of you. So it's very impressive to hear. I must make some time for some sports as well. So please share your tips.
shall I go first? It was a very long time ago. I can hardly remember. I qualified 30 years ago. And you just value every minute. And the other thing I think is, I know I've got different brains. Sometimes I'm not in the mood for something, and you always have to plan ahead. You think, I'm really not going to be in a mood, but I will save this job for Friday at 9 o'clock in the morning, and I will sit down at my desk and I will not move until it's done. I kind of have to make pacts with myself, otherwise it doesn't happen. That's my only thing. Thanks.
Yes, I agree. I didn't jump in there either, because it's a very long time ago for me as well, and I think I didn't think about work-life balance then. And I know George Bernard Shaw, I think, said youth is wasted on the young, and I don't mean to insult you guys out there, but for me, I look back now and I think, gosh, when I didn't have 3 children, I wasn't married to a consultant cardiac surgeon. If I'd known that was coming, I may have used that time more effectively. But in those days when I was at medical school, I think you're monitored a lot more about which lectures you go to and which you don't, and we weren't. So we had a lot of spare time at medical school, because really the only requirement was that you pass the exam. I didn't really care whether you went to the lectures or not. So I think probably we had maybe a better work-life balance as medical students than you do. I don't know.
Maybe. I think there's also like a little bit of pressure put on medical students currently to get as much involved into research and extracurricular activities, and sometimes we just don't really think we have time to take care of ourselves, but then we find out that if we don't do that, everything else falls apart. So I think that's why talks like that are important, to remind ourselves that we must also take care of of everything outside medical school and everything outside our future career. I think the next question has kind of been answered by Mrs. Scarlett already, but maybe we can further elaborate on that. Somebody asked, does your partner's job have an influence on how you manage the time you spend with your family?
Sorry, could you just repeat that question? My dog has just come in.
That's okay. It always happens with online things. We can just repeat it. So somebody asked, does your partner's job have an influence on how you manage the time you spend with your family?
I'll jump in there, perhaps, Scarlett. I mean, yes, definitely for me, because I'm married to a consultant cardiac surgeon, who I met across the operating table, and that he has a very busy working life as well, and so that definitely, I think, makes me run a very structured timetable. Like Scarlett said, sometimes I write down lists of things on my jobs to do that really look a bit odd there, but I just need to remember them and get them done at a certain time, because I know I won't have time later, because I'll be with the children and he'll be at work. And we have tried to manage our on-call. When the children were little, we did on-calls not together, and now the children are older, we don't do on-call, try and do on-calls at the same time, so that we have more free weekends.
I'm going to butt in as well, because although my husband's a nurse, he's also quite a traditional man. I'm just, and basically when I got home on a Friday evening, he was often out ready to go out for his boys' weekend away on bikes or boats or motorbikes or, vintage cars. He likes doing stuff. And often I get the kids at weekends and I'd be trying to drag them around the supermarket, with 4. He'd do the shopping, but anything I wanted, I'd end up dragging 4 kids around the shops. The critical thing we had was we live in town, so we had the teenagers across the road that would be on standby if I was on call, so that they would come in and babysit if I got called in. So a big tip is trying to live near where you work, because a lot of my colleagues live in these fancy houses in the middle of the country, which is, Sussex is awesome. Come to Eastbourne, awesome, lovely, but not only do they spend half an hour driving to work each way, but also if they get called in when they're on call, they have to come in a bit earlier to see everything. Whereas I can look at the x-rays on my computer at home, and then get there, I can get there in my car in 5 minutes, or on my bike in 15 minutes, or whatever it is. Don't really, really think about the geography and think about where the schools are so that your kids can cycle themselves to school. It's all that stuff. But my husband being a nurse has actually been incredibly helpful, because otherwise I'd have still been a surgeon because I'm incredibly stubborn. But we'd have had to do it in a different way. And the other thing is, he sometimes comes home and just needs to offload, and you need to be ready to receive it, because that's what a partnership's about. You need to listen and not necessarily agree, not necessarily fight, but just listen and be there, and stuff. So sorry, yeah, that's it.
I've just, if I can just come back in there and say, actually, I found being married to another surgeon, although I'm saying it's difficult in terms of timing, it's been incredibly helpful. I think for me, because I say to him, I'm worried about this patient, and he'll say, just go and see them, because he understands, and so he doesn't expect me always to switch off if I've got a patient that's not well, and he's incredibly supportive.
And it's amazing to hear the pros and cons of both, because I think everything comes with pros and cons, and I'm sure they are very understanding, both of them, because they are both healthcare professionals. But at the same time, you both are very busy people, so it makes sense that then you have to have some special arrangements to make sure that you're also taking care of each other, which I think is what a partnership is all about. I think the next question is something that people often ask. I don't really think there is an answer, but maybe you have a personal one. Somebody asks, would you say there is a best time to have children? And if so, and you think it's just dates after med school, can you do foundation years part-time?
I would say there's no right time, and you can't guarantee when they'll come or how that will go. So you can try and plan it, but I can tell you from experience it won't necessarily work out like that. I had 2 during my research and 1 during my clinical years. I didn't find it particularly different between the 2, and I think I didn't have a child as a consultant, but I think you could do that as well. So I think when I was training when they were very tiny, and I was working quite hard when they were very tiny, and I think in retrospect I probably missed out more being with them than they did with me, because now they don't remember when I wasn't there when they were tiny, but sometimes I sacrifice being with them, whereas now they're older, they're much more aware of whether I'm here or not. But I think I've got my work-life balance better when they're older. They need you more as they grow up, to be honest.
Can I just say, we've got lots of advice on the Women in Surgery. It's just free to join Women in Surgery. If you go on the Royal College of Surgeons website and look for Women in Surgery, you can join, but you can also look at the pages on pregnancy and parenthood, in fact, rather than pregnancy. We've updated it so it includes men or people of any gender, and people adopting and all that kind of thing. So yeah, there isn't a right time, and life goes on. Life is weird, and suddenly you think, was that it? 2 years ago, I was told to take ill health retirement, and I'd never work again. And I sound very stubborn, so I fought it. And it was nice to get back to work. But it's kind of suddenly I was kind of, what is that? It? That was all. I was about to do amazing things. Now the kids are getting, I was about to launch into be, chair of this and blah de blah. So I had 3 kids as a registrar and 1 as a consultant. And as a registrar, it was actually fairly straightforward. I took 4 months off with each. And there was one that was around a time I was doing exams as well. So I was luckily able to get my FRCS auth at the time. When I was 14, the only advice my uncle gave me, who was the only medic in the whole family, he was a consultant psychiatrist. When I went to see him, and I said I wanted to study medicine, he said, well, don't get pregnant until you're a registrar. And that was his advice back in whenever it was, 1980 something. And what he was trying to say is you need to be almost established, because otherwise it's quite difficult to crawl back in. And although we're here championing women and women can do anything, actually when I just had a baby, imposter syndrome massive, and you sit there thinking, God, would I ever be able to operate again? And actually you can. It's like riding a bicycle, and I should know. And all that other stuff that you don't quite make the right decisions. I couldn't possibly, I didn't feel I could go through an interview at that point, and with some of my pregnancies, and some of them I could, and as I said, I took an exam when I was 38 weeks pregnant, which was quite entertaining for everyone else, which is fine. They held up the exam when I tried to get upstairs to the Viva. It was fine, I passed. So but actually that's the same advice I was giving until fairly recently, because it's nice to have a job to come back to. When you've got everything else gone, nanny or childminder or whatever you've got, you need to have a job to come back to. But it isn't essential, particularly now that there are training rotations for core training, and it's much more transparent about how people get appointed to these registrar jobs and things. The one as a consultant was really straightforward. As I said, you can start your clinic at 9-10 on a Monday morning, and that's fine. The difficult bit is they'd got a locum for me for 18 weeks, which was fine. But he'd saved all the difficult cases for me. And I remember coming back in November and sitting down with a matron at the end of the clinic and going, blimey, I don't remember it being this hard. All these patients are really complicated. And she said, oh, don't worry, Dr. Soley, he saved the difficult cases for you, and they've all been told to come back in November for a second, and it's like, oh, okay, got it, but it worked. You can do it, you kind of forget how good you are. The other kind of little tip, breastfeeding. I love breastfeeding. I love that connection with the kid. We know it's good for a year, but actually it can be quite boring and quite tiring. But kids will do night and morning feeds. You can express milk. When I was doing these long weekends, express milk, bring it, freeze it in a freezer. It takes about 20 minutes with a pump, and you put it in a freezer in Skaboo I use, but you can use any. And then you come home and give it to daddy or childminder or nursery or whatever, and they'll feed it to the baby. But it's mainly to keep your supply going. It's not, sure, it's nice for the baby, but lots of babies will mix and match bottle and breast, and the midwives won't tell you that because they think as soon as you discover bottle, you'll give up breast. So I'm just little tip. Otherwise, your maternity leave is a year. That's great for some people, but I'd have been bothered, a lot. Thank you.
No, I think these insights are great. And I'm going to say that my mom was told the same thing, not to have children until she was a registrar. And indeed, she went to her interview just before being appointed to be a consultant. And she was pregnant of me with 7 months. And she just wore a very baggy shirt and didn't disclose that she was pregnant until she was appointed, and then just had to go on maternity leave. So hopefully things now for the newer generations are different and more flexible. And yeah, people understand that being a mom gives you maybe some great skills that you can then apply to surgery as well. But thank you so much. We still have so many questions, and it's been great to hear from you. So we will see you back in the Q&A. Thank you again so much for giving up your precious time for us. We will now put up the feedback form so we can see what everyone thought of this amazing talk. Thank you again.
Thank you.
Thank you so much, Scarlett and Elizabeth. I'll now put up the feedback form.